Good morning, everybody. Welcome in to Support Small Live. I'm Denise Curtis with the Eastern Shore Chamber of Commerce. And today we're sitting down with Kim Garrett with Victory Health Partners. They're doing some incredible work, especially right now during COVID-19. So many people are losing their jobs, losing their insurance, newly uninsured folks. And so they are such an incredible organization in our area. We want to tell you before we get started, if you have any questions, please put them in the comment section of our Facebook Live, and we'll be happy to get to those questions for you. But first, Kim, welcome. Good morning.
Thank you. Good morning. It's so great to be here.
Yes. Give us a little bit of overview of what Victory Health Partners is and what you guys do.
Sure. So we started in 2003, and we are a nonprofit medical clinic, and we take care of adults who don't have health insurance. So ages 19 to 64, people who, while we're located in Mobile, we serve all throughout our region. We serve about 25 counties in Alabama, 11 in Mississippi, and 8 in Florida. And we serve a lot of folks from the Eastern Shore. So we started off just as a primary care clinic, and we've grown to really be a multi-specialty clinic where we have specialists who come to the clinic and volunteer. So specialists like counseling, neurology, urology, wound care, surgery, OBGYN, dental, optometry, and of course, primary care every single day. And then what we don't do in our office, we refer out. So we have about 150 specialists who will see our patients in their own offices. So if someone needs to see a cardiologist or an orthopedic surgeon or a dermatologist, we can make the referral. And instead of paying a copay of $250, $300 just to sit in the exam room, they can be seen for $25. So just incredible partnerships. We get patients their medications for little to no cost. Last year was like $39 million worth of free medications. We were able to get patients through the patient assistant programs through pharmaceutical companies. Mental health is a big part of what we do. We do free counseling for our patients. So that's just a quick brushstroke of what we do, but really bridging the gap for adults who might be uninsured for a long time or newly uninsured with everything going on with COVID, just to make sure that they maintain their their health and wellness. We see a lot of patients with diabetes, high blood pressure, cholesterol, and just having access to a physician, to your medications. It's so important all the time, but especially right now during COVID-19.
So I'm sure you're seeing a lot of people that are coming in that are newly uninsured. This is a new experience because maybe they've lost a job or their insurance. Tell us about that, what you're seeing specifically from COVID-19.
Sure. Just like a lot of clinics, kind of when March and April rolled out, we did see a drop in our patient numbers because, like everybody, if you didn't have to go to the doctor, you weren't going to go. But we are seeing definitely an uptick in our established patients are coming back for their appointments, and then also an increase in new patients. So we've been seeing anywhere from 75 to 80 new patients each month, which is definitely higher, and we're seeing it continue to increase. Just as we're seeing unemployment numbers, unfortunately, increase. So it is an easy process to become a patient. All of our guidelines and information are on our website at victoryhealth.org. But we can get patients in that day, within the week. If it's for a primary care appointment, if it's more specialty, it might take a little bit, just depending on our availability, but we can get patients in and they can be seen. So we are, for all newly uninsured patients, they can feel confident and are established that we are following all CDC regulations, sanitizing, taking temperatures, triaging over the phone, so they can feel confident that we're doing everything that we can here to keep them safe and well. But for those adults newly uninsured, we want them to know that Victory is open. We're here for them. Hopefully it's just a short time that they might be without health benefits. But for someone, like I said, with who's diabetes, who needs their insulin, who needs their high blood pressure medication, or if someone needs to talk to a counselor, it's definitely a stressful time. We're here and we can provide those things for our community, so that they stay healthy and well during this time.
For the business community specifically, what would you like for business owners and managers to know as they're having to make these tough decisions?
Oh, absolutely. I mean, I know I can't imagine those decisions that they have to make about, having to look at their payroll and see who they can keep, who can't. It's so complicated right now. So to those managers, to those, kind of leads for their small business and small business owners, like, again, to know that victory is here, so that when they do have to make those hard decisions, and letting people go, that the victory is here to take care of them, so that they can give, some information or a flyer, or just sharing about victory, so that, as that employee maybe leaves that company, they know that victory is here for their healthcare needs, and we can get them taken care of.
If somebody wants to get in touch with you or learn more about Victory Health Partners, how do they go about doing that?
Sure. Our website is a great resource. It has all of our contact information, everything about who we are, especially patient information. And that's victoryhealth.org. And then, of course, people can reach out to me directly at the clinic. Our direct number is 251 460 0999. Or, my email, kgarrett@victoryhealth.org. We want to make sure that, anyone who's interested in learning more and becoming a patient, that they can get in touch with us, any way that they can. So, and all that's on the website as well.
Perfect. Thank you so much. We'll be happy to put all that contact information in the comment section for anyone who didn't get a pin out quick enough. Is there anything else you'd like to add today?
I think we covered a lot of it, but again, we are here. We've been open this whole time. Definitely, we are essential, and we want to be that safety net for our business leaders, for our community, anyone who's facing being without health insurance. A lot of uninsured adults, they have to delay or prolong just because the cost of healthcare is so expensive, and then they might end up in a emergency room for something that could have been prevented, or could certainly be seen in an office like Victory. And certainly, we want to keep everyone out of the hospital, out of the ER, be there right now. So we're definitely a solution for that. And as Victory is a ministry, it's faith-based. Of course, it's not forced on anybody, but it's certainly a place where our community and those in need, our patients, can find healing and hope during this time. So we are here, and we're ready to serve and take care of anyone who is in need.
Thank you so much. Thank you for joining us, Kim. I appreciate it.
Yes,
And
thank
for
you.
everyone else, thank you for joining us. We'll be here on Tuesday, July 21st, talking with Baldwin County Virtual School about our options for Baldwin County for virtual education this upcoming fall. So please join us for that right here on Facebook Live at 11 o'clock on Tuesday, July 21st. Thank you so much. Have a wonderful day.
Thank you.